My name is Brandy, and I am going to be doing some pregnancy vlogs. This is my first one. I am 13 weeks. Well, actually, I am 12 weeks and 6 days, but I will be recording my videos on Fridays, which is one day shy, every week. Saturdays are just too crazy around here to even try to make a YouTube video. So this will be my official 13-week video. I found out that I was pregnant on May 4th, and I am due January 8th. I'm very excited and very scared and nervous, all those emotions, which are pretty normal. I guess in this video I'll be talking about the first doctor's visit and like morning sickness and stuff like that. I had my first doctor's visit at 6 weeks, and it was like a 2-hour visit. You'd get a full exam, and then I had a nurse talk to me for almost an hour getting family history and lots of personal information. So I hope you're not shy. If you are pregnant, have to go in for your first appointment. My doctor's office is very intense, but it's all for good. I opted for every optional test, so they took a lot of blood, and I had extra exams that I didn't know hurt so bad, but I just want to make sure everything's okay with the baby, and everything came back good. Those 2 weeks that they tell you to wait, it was horrible. I was just waiting for the phone to ring, and actually I did get a phone call like the second day after I went to the doctor telling me I had an infection and I had to pick up some antibiotics. And then I was just waiting for them to say something was wrong with the numbers or something, and then I called exactly 2 weeks later, and I was like, nobody's called me, is everything okay? And they said that everything was perfect, so it was such a relief. I was stressing out so bad, and then I had a sonogram appointment at 7 weeks and 6 days, and it was good. It was good to hear the heartbeat. It was an internal sonogram, so it wasn't. They tried to do an external one, but they couldn't catch the heartbeat, so it wasn't that comfortable for me because I have I don't know if this is too much information, but I have a tilted cervix, so everything is a little bit more uncomfortable. But it was good. You just, at that early stage, the baby doesn't look like a baby yet. It's just like 2 spots on, a photograph. One, is the yolk sac, and one is the baby. And then, let's see, I've had 2 more doctor's appointments since then. One of them was just a regular doctor's appointment. They push on your stomach and listen to the baby's heartbeat for like 5 seconds and then kick you out. And that was good because she said the baby had a really strong heartbeat. And then I opted for a first trimester screening at the hospital where they do an ultrasound to test the fluid or the skin, the nuchal translucency test, the baby's neck and nasal bone, and that was really good because we got pictures of the baby, and the baby was kicking and moving around quite a bit, crossing his or her legs. It was the most beautiful thing I've ever seen. And she was trying to measure the baby, but I couldn't stop crying, so my stomach wouldn't sit still, so she kept helping me start over. And then they prick your finger, and then they kick you out, and then in 5 days they'll call you if you have, possibility of having a baby with a chromosome problem. So I had that on Wednesday. So by next, Wednesday, this next Wednesday, I'm going to be a little stressing out. And then I am opting for the second trimester screening as well. But I can't make that appointment yet. As for morning sickness, my morning sickness started, I had fatigue around 5, 6, 7 weeks. I wasn't sick or anything. I was just really tired, and I could just lay all day, which isn't like me at all. And then after that, about between 7 and 9 weeks, I had a lot of nausea, but no actually throwing up. And then it was like a lot of nausea, not so much throwing up, just a little bit throwing up for the next week or so. And then the last 2.5 weeks, it's been not really nausea, but just instantaneous sickness, I guess. Like a lot of throwing up. Like I can't eat anything. You know, I'll eat breakfast. You know, I don't have it for 5 minutes. My mom keeps telling me, just keep eating breakfast because your baby gets the nutrients for 5 minutes at least. But I don't. It's hard to want to eat, so I've lost a couple of pounds during pregnancy, which I guess is pretty normal. You know, if you're having morning sickness, you can't eat anything, and when you do, it just comes back up anyway. So, but I can see the light at the end. I don't think it's going to last very much longer. I've also had a lot of dizziness, and I did call my doctor about that because it's not just like a little bit of lightheaded. It's been like I've been really, really dizzy. And she made me feel a little bit better about that. Just I can't lay on my back, which I didn't know it was bad to lay on your back. I know I can lay on my stomach, but I didn't know I couldn't lay on my back, and I'm not a side sleeper at all. So the last few days after realizing that it's so bad to sleep on your back, I've not slept so great at night. I really had to train my body how to sleep on its side comfortably. But I don't have another doctor's appointment until July 15th. And it's just another, they say it's a 15-minute appointment, but it's really just a 5-minute appointment. You sit and wait for 40 minutes, and then they take your weight, your blood pressure, and then the doctor sees you for like a second. She just push on your stomach and check the baby's heartbeat and kick you out. So, but that's it. This is my first video, so I'll be doing another one next Friday. Thanks, guys.